14. Alarming signs of diabetes that doctors rarely mention. Have you ever woken up in the middle of the night feeling a thirst that seemed impossible to quench? What if this seemingly innocent symptom was revealing a serious health problem? How many times have you ignored tingling in your feet, thinking it was just tiredness? Diabetes affects more than 30 million Americans. But the scariest thing is that 1 in 4 don't know they have the disease. The signs are there, silently present in your daily life, sending desperate messages that your body urgently needs help. Which of these 14 signs are you experiencing right now without realizing that they are diabetes alerts? Over the next few minutes, I'll reveal exactly how to identify these symptoms before it's too late, and more importantly, what you can do to reverse this situation today. Let's get started. 1. Unquenchable thirst at night. Your body's desperate cry for balance. Have you ever wondered why you wake up in the middle of the night with such an intense thirst that it seems impossible to quench? This is not just a nighttime inconvenience, but a telltale sign that your body is struggling to process sugar. When blood glucose levels rise, your body works tirelessly to eliminate excess through urine. This intense process pulls water from the cells, creating a state of persistent dehydration that your brain registers as extreme thirst. It's as if every cell in your body is screaming for hydration while you sleep peacefully. The vicious cycle between thirst and frequent urination is often the first silent sign that your blood glucose is out of control. Imagine your system as a river overflowing its banks, dragging essential nutrients with it and leaving behind cellular imbalance. This thirst is not just a nuisance, but a desperate protective mechanism of your body trying to dilute excess sugar. Ignoring this symptom can speed up the path to serious complications like kidney damage and chronic dehydration. Doctors often underestimate the importance of this symptom when reported in isolation, focusing only on fasting glucose levels. Early recognition of this pattern can literally make the difference between early diagnosis and years of silent organ damage. Think about it. Your body rarely invents symptoms for no reason. Every intense nighttime thirst is a coded message about your metabolism. But how do you know if your thirst is normal or a warning sign? If you're filling your glass of water 3 or more times overnight, it's time to pay attention. What if I tell you that this is just the beginning of a cascade of symptoms that your body is desperately trying to communicate? 2. Night bathroom. Why did your late nights turn into a nightmare? You know that frustrating feeling of being pulled out of deep sleep by the urgent need to use the bathroom? Nocturia, the medical term for frequent nocturnal urination, is much more than a simple inconvenience for those who suffer from diabetes. Every nighttime visit to the bathroom is a clue that your body is struggling to process excess glucose in your blood. When your blood glucose crosses the kidney threshold, your kidneys work extra shifts to filter that excess through your urine. This natural response of the body creates a diuretic effect, drastically increasing the volume of urine produced even during sleep. The result is an exhausting cycle. High sugar levels lead to increased urine production, which in turn causes dehydration and thirst. The constant sleep disruptions caused by this cycle can seriously compromise your quality of life and overall health. Imagine your body as a factory that can't shut down at night because it's overloaded processing excess sugar. The sleep fragmentation resulting from this constant cycle negatively affects your glycemic control the next day. This ripple effect creates a vicious circle where poor diabetes control worsens nocturia, which in turn worsens diabetes control. People without diabetes rarely need to urinate more than once during the normal 8-hour sleep period. If you're standing up 3 or more times consistently, your body may be signaling an underlying metabolic problem. The frequency and volume of nighttime urination may be more accurate indicators of glycemic control than some standard tests. The cumulative impact of sleep deprivation resulting from this pattern profoundly affects your mood, cognition, and ability to manage your health. But here's a startling revelation. Many doctors fail to connect this urinary pattern with early-stage diabetes. What if you knew that this seemingly annoying symptom could be the key to preventing more serious complications in the future? 3. Dry mouth and endangered teeth. The hidden trap of sugar. Have you ever noticed how strangely dry your mouth feels, regardless of how much fluid you consume during the day? Xerostomia, or dry mouth, is not just a temporary discomfort for people with diabetes, but a biological warning sign. This dryness occurs because the same mechanism that increases urine production also significantly reduces saliva production. Saliva isn't just water. It's a complex fluid containing enzymes, antibodies, and compounds that actively protect your teeth and gums. When their production decreases, it creates the perfect environment for bacteria to thrive, dramatically increasing the risk of cavities and gingivitis. The connection between diabetes and dental problems is so deep that attentive dentists are often the first to suspect the disease. People with uncontrolled diabetes have a threefold increased risk of developing severe periodontal disease compared to the general population. Chronic inflammation of the gums not only destroys the supporting tissue of the teeth, but also makes glycemic control even more difficult. This two-way relationship creates a cycle where diabetes worsens oral health, which in turn further complicates diabetes management. More alarmingly, oral infections can significantly raise blood glucose levels, aggravating existing diabetic complications. Dryness can also affect your ability to taste food, leading to food choices that can worsen the condition. Persistent halitosis, that bad breath that toothpaste doesn't solve, can be another telltale sign of this complex connection. Cracks in the corners of the mouth and sore tongue are frequent manifestations that many doctors do not immediately associate with diabetes. Premature tooth loss in adults with no other significant risk factors can be a silent sign of undiagnosed diabetes. The psychological impact of these oral problems often leads to social isolation and depression, further complicating the overall picture. What your dentist can see in your mouth could reveal a lot more about your metabolic health than you realize. 4. Mysterious itching, the symptom you've been ignoring, could cost you your health. Have you ever felt that unexplained itch that seems to come from inside the skin and no moisturizer can relieve it? Persistent itching, especially in the extremities, is often dismissed as dry skin or allergy, but it can indicate diabetes. When glucose remains elevated in the blood, it changes the composition of body fluids and directly affects the small blood vessels in the skin. This vascular alteration drastically reduces the skin's ability to stay hydrated and nourished, resulting in extreme dryness. Dry diabetic skin doesn't respond well to regular moisturizers because the problem starts internally, not on the surface. The relationship between diabetes and itching is so significant that specific areas affected can even hint at how long the condition has been present. Intense itching in the legs, feet, or genital area can indicate not only dehydration, but also the beginning of peripheral nerve damage. Diabetes favors the growth of fungi and bacteria on the skin, creating recurrent infections that intensify the sensation of itching. Darkened, velvety patches, particularly in the folds of the neck and armpits, known as acanthosis nigricans, signal insulin resistance. This skin manifestation is so specific that some dermatologists consider it a visual marker of prediabetes or type 2 diabetes. The cycle of constant scratching can create microlesions on the skin that, due to compromised healing in diabetes, turn into chronic wounds. Unexplained rashes that appear and disappear may be reactions to glycemic uncontrol and not simple dermatitis. Skin sensitivity to common products can increase dramatically, turning products once tolerated into triggers for severe irritation. Extreme dryness can cause painful cracks, especially in the feet, creating gateways for potentially serious infections. The persistence of itching after conventional treatments should be a red flag for further metabolic investigation. Why do so many doctors fail to recognize this sign when it could allow for much earlier diagnosis and treatment? 5. Wounds that don't heal, when your body loses the battle for healing. Have you ever noticed how that small cut or scrape that should heal in days is still open weeks later? Slow healing is one of the most dangerous and underestimated signs of diabetes, revealing profound impairment in cellular repair mechanisms. When glucose remains chronically elevated, it systematically damages the small blood vessels that feed the skin and tissues. This microvascular damage drastically reduces the flow of oxygen and essential nutrients to the injured areas, compromising healing. White blood cells, which are responsible for fighting infections and initiating repair, become dysfunctional in a hyperglycemic environment. The healing process that takes days in healthy people can extend for weeks or months in the presence of uncontrolled diabetes. Collagen, a fundamental protein for tissue reconstruction, forms abnormally when exposed to high levels of glucose. This alteration in collagen structure results in weaker scars that are prone to reopening with minimal trauma. The sugar-rich environment creates ideal conditions for bacterial proliferation, turning small lesions into persistent infections. Even minor foot injuries can quickly develop into deep ulcers when healing is compromised by diabetes. Alarming statistics show that 85% of amputations in diabetics begin with a simple wound that has not healed. The gradual loss of protective sensation due to diabetic neuropathy causes many of these wounds to go unnoticed until advanced stages. The fatal combination of reduced blood flow, compromised immunity, and sensory loss creates the perfect storm for serious complications. Regular monitoring of the feet with a mirror, looking for even minor injuries, can literally save limbs and lives. The unusual smell in wounds is a critical sign of infection that requires immediate medical attention, not just home dressings. This silent complication of diabetes could be prevented with early diagnosis. But what if you don't already know you have the disease? 6. Infections that keep coming back. Your immune system is sending an SOS. Have you ever wondered why you seem to catch all the flu of the season while others around you stay healthy? Recurrent infections are not only bad luck, but they can be a telltale sign that your immune system is compromised by diabetes. High blood glucose directly interferes with the ability of immune cells to identify and destroy invading pathogens. Neutrophils, the first line of defense against infections, become slow and inefficient when exposed to a hypoglycemic environment. The result is a weakened immune response that allows bacteria, fungi, and viruses to establish themselves and thrive in the body. People with undiagnosed or poorly controlled diabetes have up to a 5-fold higher risk of developing infections compared to healthy individuals. Recurrent urinary tract infections, especially in women without other risk factors, may be an early sign of altered glycemic metabolism. Recurrent oral or genital thrush, commonly referred to as thrush, often indicates high blood sugar levels. Boils, skin abscesses, and folliculitis that appear repeatedly are outward manifestations of an overburdened immune system. Sinusitis and bronchitis that take weeks to resolve or return soon after antibiotics are finished suggest compromised immunity. The pattern of infections is so characteristic that some experienced doctors suspect diabetes just by looking at the patient's infectious history. The disproportionate severity of common infections, turning a simple cold into pneumonia, is another red flag sign. Reduced response to vaccines and persistence of post-infectious symptoms are also subtle indicators, rarely associated with diabetes. Fungal nail infections, resistant to conventional treatments, often accompany early stages of metabolic disease. The cumulative impact of these recurrent infections goes far beyond immediate discomfort, accelerating long-term diabetic complications. What is your body trying to say through these infectious episodes that never seem to end completely? 7. Sudden blurred view, the silent alarm that can save your vision. Have you ever experienced those disconcerting moments where your vision suddenly blurs as if you're looking through frosted glass? Intermittent blurred vision is often dismissed as eye strain or the need for glasses, but it can be a critical sign of diabetes. When glucose levels fluctuate significantly, the shape of the eye lens changes, drastically affecting your ability to focus. This phenomenon occurs because excess sugar in the blood forces fluids in and out of the lens, temporarily changing its curvature. Many patients report that their eyeglass prescription seems to change frequently, without ophthalmologists identifying the underlying cause. Blurry vision can be the first detectable sign of damage to the tiny blood vessels that nourish the retina, long before other symptoms. Diabetic retinopathy, the main cause of preventable blindness in adults, begins silently, with small vascular changes that are imperceptible to the patient. The progression of this damage can occur for years without obvious symptoms, until sudden visual changes signal advanced complications. Floating spots in the visual field, flashes of light, or areas of obscured vision are warning signs that require immediate medical evaluation. Loss of peripheral vision, often attributed to normal aging, may actually indicate progressive diabetic retinopathy. Difficulty adapting to changes in lighting, especially when entering dark environments, suggests early retinal impairment. Altered color perception, particularly difficulty distinguishing shades of blue and yellow, is a subtle sign rarely associated with diabetes. Unexplained eye pain, a feeling of pressure, or visual fatigue disproportionate to eye use, may indicate significant glycemic changes. Diabetic macular edema, a buildup of fluid in the central region of the retina, can cause visual distortions where straight lines appear wavy. Accelerated visual deterioration in people under the age of 50 should always trigger thorough metabolic workup. How long would you wait with visual symptoms before seeking help that could save your vision? 8. Unexplained tingles and pains. Your nerves are crying out for help. Have you ever felt that strange tingling sensation on your fingertips or feet, as if little pins were sticking at your skin? Diabetic neuropathy, nerve damage caused by high glucose, affects up to 50% of people with diabetes. The destructive process begins quietly, with excess glucose slowly damaging the myelin sheath that protects nerve fibers. This progressive damage initially manifests itself as subtle tingling or numbness, often overlooked as inappropriate sleeping positions. Over time, the sensation evolves into intense burning, sudden electric shocks, or sharp pains that worsen significantly at night. The characteristic pattern of diabetic neuropathy starts in the extremities and advances symmetrically, as if you were wearing invisible gloves or socks. The contrast between decreased sensitivity to light touch and amplified pain is a classic neurological signature of this diabetic complication. The gradual loss of protective sensation causes injuries to go unnoticed, dramatically increasing the risk of injury and infection. Neuropathy not only affects sensations but also muscle control, resulting in progressive weakness and changes in gait. Extreme sensitivity to touch, where even the weight of the sheet on the feet causes intense discomfort, indicates significant nerve damage. The impact of these symptoms on sleep quality is devastating, creating a vicious cycle that aggravates both glycemic control and neuropathy. Neuropathic pain is notoriously resistant to conventional painkillers, often leading to dependence on increasingly strong medications. Autonomic nervous system involvement can cause seemingly unrelated symptoms such as dizziness when standing up and digestive problems. The silent progression of this condition means that many patients only seek help when substantial and irreversible damage has already occurred. The good news is that tight glycemic control in the early stages can effectively halt or even reverse this nerve damage. Why wait until the pain becomes unbearable when the first tingles are already trying to alert you? 9. Restless legs in bed. The nightmare before you even fall asleep. You know that gut-wrenching feeling of not being able to keep your legs still when you try to wind down at night? Restless leg syndrome, RLS, is characterized by an overwhelming need to move the legs, often accompanied by uncomfortable sensations. These sensations are typically described as tingling, pulling, crawling, or itching deep inside the legs, not on the surface of the skin. Symptoms intensify during periods of inactivity and especially at night, making sleep onset a real challenge. The movement temporarily relieves discomfort by forcing many patients to repeatedly stand up or swing their legs in bed. Studies reveal that people with diabetes have a 4 times higher risk of developing restless legs syndrome compared to the general population. The connection likely involves damage to the small nerves in the legs caused by elevated glucose and compromised blood circulation. The impact on sleep quality is profound, with patients often reporting less than 5 hours of uninterrupted sleep per night. This chronic sleep deprivation creates a devastating cycle, as insufficient sleep worsens glycemic control, which in turn worsens RLS symptoms. The syndrome often progresses over time, with episodes becoming more intense and occurring earlier in the day. The diagnosis is predominantly clinical, based on the symptoms reported by the patient, since there are no specific laboratory tests. Common nutritional deficiencies in diabetics, especially iron and magnesium, can significantly exacerbate symptoms. Certain medications used to treat diabetic complications can paradoxically worsen RLS, creating a complex therapeutic challenge. Relaxation techniques, warm baths before bed, and leg massage offer temporary relief for some patients. Strict glycemic control remains the most effective intervention to reduce the frequency and intensity of episodes. How much longer are you going to allow restless nights to steal your energy and compromise your health? 10. Cramps that awaken at dawn. The pain that hides a metabolic secret. Have you ever been jolted from sleep by a stabbing pain in your calf, so intense that it makes you sit up in bed screaming? Night cramps, painful and involuntary muscle contractions, affect up to 60% of people with diabetes. These muscle spasms occur when the communication between nerves and muscles is compromised by metabolic changes related to diabetes. The mechanism involves electrolyte imbalances caused by altered renal function, chronic dehydration, and peripheral nerve damage. Diabetic cramps have a characteristic pattern, occurring predominantly during deep sleep between 2 and 4 in the morning. The disproportionate intensity of these cramps compared to those experienced by people without diabetes is a significant marker of metabolic uncontrol. Location also provides important clues, with foot and toe cramps being particularly suggestive of underlying diabetic neuropathy. The frequency and intensity of cramps correlates directly with glycemic control, serving as a biological barometer of treatment effectiveness. The vicious cycle sets in when the pain of cramps disrupts sleep, raising stress hormones that in turn raise blood glucose. Chronic dehydration, resulting from hyperglycemia, reduces blood volume and concentrates electrolytes, creating the perfect environment for severe cramps. Excessive loss of magnesium and potassium through frequent urine compromises normal muscle function, predisposing to involuntary contractions. Stretching exercises before bed, adequate hydration, and mineral supplementation can significantly reduce the frequency of episodes. The persistence of nocturnal cramps despite these interventions should serve as a wake-up call for further investigation of glycemic control. The momentary cramp pain is just the tip of the iceberg of a much more complex process quietly occurring in your metabolism. What if this painful symptom is actually an opportunity to detect and treat diabetes before more serious complications develop? 11. Emotional outbursts. How your sugar is hijacking your mood. Intense mood swings can be direct signs of glycemic instability, often mistaken for stress or tiredness. Fluctuations in sugar levels affect neurotransmitters such as serotonin and dopamine, which are essential for regulating emotions, resulting in irritability, anxiety, or depressive symptoms. The diabetic brain lives under constant metabolic stress, profoundly altering emotional processing. Episodes of hypoglycemia can cause aggression and confusion, while hyperglycemia causes brain inflammation, lethargy, and depressed mood. Often, family members notice these changes before the individual himself. The link between diabetes and depression is so strong that diabetics have twice the risk of developing clinical depression, creating a damaging cycle between emotional changes and glycemic control. Studies show that sugar fluctuations directly affect brain structures involved in emotional processing. Glycemic stabilization can dramatically improve emotional state, sometimes more than psychiatric treatments. Regaining this stability can profoundly transform your life and your relationships. 12. Fainting during sleep, the nocturnal risk that few know about. Have you ever woken up feeling strangely exhausted, as if you had gone through a battle through the night without remembering? Nocturnal hypoglycemia, a dangerous drop in sugar levels during sleep, is one of the most dangerous and least recognized complications of diabetes. During sleep, your body continues to consume glucose for basic functions, potentially causing critical drops in blood levels. This phenomenon is particularly insidious because the normal alert mechanisms that function during the day may be suppressed during sleep. Initial symptoms, such as tremors, sweating, and palpitations, may occur without completely awakening the person, masking the impending danger. In severe cases, nocturnal hypoglycemia can cause seizures, loss of consciousness, and even be life-threatening if left untreated. Telltale signs include vivid nightmares, intense night sweats, and waking up to damp bedding even in cool surroundings. Unexplained morning headaches, confusion upon awakening, and fatigue disproportionate to the time slept are clues that are often ignored. Many patients report a hangover feeling in the morning, even without alcohol consumption the night before. Continuous monitoring of glucose at night reveals that episodes of hypoglycemia are much more common than previously recognized. Risk factors include nighttime doses of insulin, intense exercise in the afternoon or evening, and alcohol consumption before bedtime. Recurrent hypoglycemia can eventually lead to hypoglycemic unconsciousness, where the body loses the ability to recognize dangerous sugar drops. Preventive strategies include late-night snacks rich in protein and complex carbohydrates, and adjustments to medications under medical supervision. Modern continuous glucose monitoring devices with alarms can literally save lives by alerting you to dangerous falls during sleep. Bed partners trained to recognize signs of nocturnal hypoglycemia have intervened in numerous life-threatening situations. What happens in your body during those 8 hours of sleep may be more crucial to your health than you realize. 13. Intense night sweats. It's not menopause. It could be diabetes. Night sweats, episodes of excessive sweating during sleep, can be signs of hypoglycemia, especially in people with diabetes. When blood glucose drops dangerously late at night, the body releases adrenaline and stress hormones to correct the drop, intensely activating the sweat glands. These episodes usually occur between 2 and 4 in the morning, coinciding with the period of lowest blood glucose. Unlike sweating caused by heat, these episodes are accompanied by palpitations, tremors, and nightmares. Many mistakenly attribute these symptoms to anxiety or sleep problems. Recurrence, especially with morning fatigue, merits investigation. Long-acting medications, such as some insulins, increase the risk. Monitoring blood glucose before bed and using continuous devices help identify and prevent episodes. A snack with protein and complex carbohydrate before bed can stabilize sugar levels. Keeping a diary of episodes makes it easier to adjust treatment. Your body may be sending important signals. Pay attention. 14. Pauses in breathing. The unexpected link between diabetes and apnea. Sleep apnea, characterized by repetitive pauses in breathing, affects up to 70% of type 2 diabetics, creating a dangerous cycle of complications. Each respiratory interruption reduces oxygen in the blood, triggering hormones such as cortisol and adrenaline, which raise glucose. In addition, sleep fragmentation impairs insulin sensitivity, even in non-diabetics. Although obesity is a risk factor, it does not fully explain this association, indicating more complex mechanisms. Symptoms such as drowsiness, difficulty concentrating, and irritability are often confused with the effects of diabetes itself. Fatigue caused by apnea makes it difficult to maintain an exercise routine, which is essential for glycemic control. Diagnosis involves sleep study, but warning signs include loud snoring and breathing pauses. Treatment, usually with CPAP, significantly improves glycemic control. Simple strategies such as losing weight, avoiding alcohol, and sleeping on your side also help. Therefore, experts recommend screening for apnea in all diabetics. Turn warning signs into years of healthy living. Now that you know the 14 alarming signs of diabetes, you have an important advantage: the power of early recognition. Each symptom is a valuable warning from your body, and understanding them can add years of quality to your life. Diabetes is not a sentence, but a condition that can be controlled with small, consistent changes in daily habits. The knowledge gained is your most powerful tool for regaining metabolic health. Studies show that those who are diagnosed early and change their habits can reverse prediabetes. Even with a confirmed diagnosis, strict control prevents practically all complications. Modern technology and supportive communities offer essential resources, while healthcare professionals can create personalized plans. Don't let fear stop you from seeking answers. The courage to act today will avoid complications tomorrow. Every small step creates positive momentum. You deserve a healthy life, and that transformation starts now.